The Bronx has a sizable population of older adults, with about 14% of the community being 65 and older. And while many older Americans are living longer, they are dealing with a great number of chronic health conditions threatening their ability to stay independent. Now, we know that regular doctor visits are important, but today we'll hear and learn why rehabilitation therapists also have a critical role to play in helping us stay healthy as well as independent as we age. And we are pleased to have joining with us the occupational therapist at VNS Health, Cecile Hall. And Cecile, thank you for joining us.
Thank you for having me, Darren.
I'm glad to have you because, your role is very critical. And for people who deal in fine motor skills, I know that an occupational therapist is really necessary. But I'll start off with the baseball question, which is like I'm just throwing it out here, right? Talk to me, because we hear a lot of people say physical therapy. We hear a lot of people say occupational therapy, and they are two different, distinct things. So I want us to first clarify the difference between occupational therapy and physical therapy.
Okay, so usually I always joke around with the patients when they ask me that, because that's a common question that I get from patients. And I usually say, occupational therapy, we deal from the waist up, physical therapy from the waist down. But pretty much for occupational therapy, we work with patients to improve their fine motor, visual, cognitive, perceptual skills, for everyday tasks, like maybe buttoning a shirt, putting on shoes, tying, cutting their food, feeding themselves to make life easier. Physical therapy, and then we also do upper extremity strengthening exercise with patient who has, whether it's from a stroke, hemiplegia, or maybe shoulder replacement. Physical therapy, they concentrate mainly on ambulation, balance, gait. They do stairs and, lower extremity strengthening exercises as well.
When you first take on a patient, obviously sometimes it can be a challenge because there's an emotional skill set, there's a mental skill set. How much does all of that weigh into the work that you do?
Well, it definitely plays an important part with every day, because a lot of times, when you have a patient and they're probably, depressed, because of their illness, and pretty much have to, work with them to try to motivate them. Sometimes, wind up maybe joking around with the patients, and saying, okay, we're going to do a little dance, we're going to do the electric slide when you're done, and, try to, let them feel, a little positive about that. So you try to work with them and tell them this is going to benefit you, to help you to get stronger, to get better, to be more independent. So a lot of it, you have to, what we call therapeutic use of self, trying to motivate and encourage the patient to do what they need to do to become independent.
Yeah. Is there a lot of resistance sometimes going into a situation, because the goal, as you said, is to really try to get somebody to live independently, live safely on their own.
Yes,
And
correct.
sometimes that's not always too well received, or I know that there has to be a certain set of challenges that you face. Talk about sometimes what the challenges are of being that occupational therapist.
Well, a lot of times you will go into the homes and the patient will say, "Oh, I don't need occupational therapy. I just want to walk." And they're more centered in getting, the physical therapy. So when you sit and, you explain and say, well, yes, so for you to walk, to hold on to the walker, you're going to need to, strengthen your upper extremities to be able to hold yourself up, and to be able to ambulate, and, to, do all the things that you need to do to become independent. So there are always a lot of challenges where patients are down, they don't really want to do anything, and, you work with the family member to try to get them to, you know, accept and work with you.
Yeah.
So it's, yes.
And I think a lot of people say, listen, I want to stay as independent as possible for as long as possible. And unfortunately, sometimes when people come your way, that's been compromised. But for somebody who's watching right now, saying, listen, you know what? I'm trying to stay as independent. I like you, but I'll wait till I have that appointment. What can I do to really keep myself in good shape? What are some basic things? Because there's some small things I'm sure we can be doing around the house without having to necessarily make it to a gym.
Well, usually when we go in and with the patient with the exercise program, we usually will give them, the sheet or something with the exercises that we go through with them. Sometimes we engage the family member to work with us and carrying over the exercises when we're not home. Because a lot of times, a lot of patients will say, "Oh yeah, I didn't do the exercises that you gave me. I'm just waiting for you to come." And I always explain to them that for you to get the most out of this, you have to continue with the exercises, when I'm not there or even when we're gone. So you have them go through it, and like I said, you try to engage a family member to help them with the exercises on a daily basis.
And getting out in the neighborhood, how important is that in terms of walking and really trying to get people to embrace that? Because there's often a saying that somebody's normal is somebody else's miracle, but to get somebody out there to a place where they can be able to walk and become independent, huge step.
Yes, it is. Yes, so usually it's a team effort. We work with social workers, physical therapists, the speech pathologists, and the other discipline nurses, home health aides, and we also engage a home health aide in walking the patient, exercising with them as well, and motivating them to become independent because that's the end goal, to work with them to become independent in the home.
Yeah. Well, Cecile, I want to thank you for the work that you do, helping so many people and so many lives to really get back on track and to encourage them. Thank you for being that great occupational therapist. For you, before we go, what does it mean for you to be an occupational therapist?
For me, it's when I can help someone and I can see the results. A lot of times when I go into the field and or I'm out in a store or somewhere and a patient will come up and say, "Hi, remember me? You're my occupational therapist." And that makes me feel good seeing this patient out in the community doing, being independent and doing what they have to do. So that's one of the gratification that I get. And patients telling me that, "Thank you so much, you helped me, to regain my independence and, to function at my optimal level."
Well, I'm not a patient, but I want to tell you, thank you so much for helping the people in our community. Great job, Cecile. Thanks, and glad to have you here with us here on the show.
I appreciate it. And thank you so much for having me.
All righty. Well, I want to let you know if you want more information, all you got to do is visit the website at vnshealth.org or pick up the phone and call 1-866-986-7691. We encourage you don't go anywhere. We'll be back with more open right after this.